Hi, this is Dr. Stefan. In this video, I'd like to answer to the second part of a question I received on the channel about Seretide Diskus, and this is from Michael. And the first question was, how fast does Seretide Diskus relieve respiratory symptoms? I've already answered that in another video, but his second question was, does it have any side effects? And this is quite important because many people are really worried about side effects when taking any sort of medication. What I'd like to say from the get-go is that inhalers, as a general rule, have very few side effects. Why is that? You don't have to believe me, but do discuss this with your doctor to confirm if you want. Basically, what it is, inhalers have very low doses of medication in them. So because you're inhaling the medication straight into your lungs where it's needed, you don't need a lot of it. If you're taking a tablet, for example, you have to swallow the tablet. The tablet needs to dissolve in your stomach. It needs to be absorbed in your bloodstream. The blood circulates all over the body and eventually reaches the lung in a sufficient concentration to treat said disease. But if you're taking an inhaler, you only need a little bit of medication to reach the same concentration in the lungs. And you're taking it through the airways, which is exactly where they need to act. Because generally, for example, in a condition like asthma, you are having a lot of inflammation on the lining of the airway. So imagine if you're trying to control the inflammation in the lining of the airway. So imagine there's a tube, the airway is a tube, right? And then basically the inflammation is on the inside bit. So this is where the air goes in, right? See, the air goes through here. The outside is where the vessels are. So if you're trying to control the inflammation inside the airway, imagine that the best way to do that is to inhale a medication that goes straight to that point. If you're taking a tablet and goes the other way, you need a higher concentration in order to reach the lining of the airway on the air interface, basically, in a sufficient concentration. So this is how I generally try to explain these things. And of course, you can still have some sort of side effects. Generally, it's related to the medication not reaching its intended target. So, for example, if you're taking the inhaler incorrectly and some of the powder gets stuck to your vocal cords, you might develop a hoarse voice. Or, for example, you might develop a little bit of a fungal infection at the back of your throat because of the corticosteroid, which is an anti-inflammatory medication contained in inhalers. So sometimes you can have these sort of side effects. Some people occasionally can have palpitations if they're taking too much of a reliever inhaler. So for example, you're using the blue inhaler a lot, you might get a little bit jittery because it's a bit of a stimulant. Or some people who have certain heart conditions like heart rhythm disorders, they may sometimes get a little bit more of that because they've been using a lot of inhalers. But it's actually quite rare to have that because of the doses involved. So it's really a question of taking very, very low doses of medication with inhaler. So that makes them extremely safe. They're some of the safest medications you can take, actually. They're generally a lot safer than tablets or injections or anything like that. So I would say don't be too worried about side effects. I think the main thing is that the benefit of inhalers in controlling potentially very severe conditions far outweighs the potential risks. So if you have any issues with any inhaler, just remember that there are tens of inhalers out there. You generally can find something else that will probably work your case and control your condition, even though it's not the same medication. So there are a lot of options in this field. And it's actually great that compared to maybe 20, 30 years ago, now we have so many inhalers to choose from. And I think that's absolutely fantastic. So don't hesitate to talk to your doctor to choose the best inhaler in your case, because every patient is different. Everyone has a different approach, a different way of working these devices. So it's important to have the right inhaler for you. An inhaler you can use correctly to prevent as much of the side effects as you can. And one tip that I can give you is basically, whenever you take an inhaler, I think it's a great idea at the end to take a bit of a sip of water. At the end, just gargle, spit it out, and then that helps with removing any excess medication that may have been left at the back of your throat. Hopefully this was helpful. If you have any other questions, do leave them in the comment section below, and I'll see you in future videos. All the best.